Okay, here we are under some very terrible overhead lighting. Who likes overhead lighting? And we are going to do another blog summary video today. So bear with me here. This will probably be about 10 minutes. I'm going to try to summarize the blog that I just put out and provide some useful tools for everyone. So this theme of this blog is really focusing on side effects from hormone therapy, particularly kind of letrozole, aromatase, anastrozole, tamoxifen, kind of those groups of hormone therapies that you tend to see in hormone-sensitive breast cancers. We outlined some of the main side effects that we tend to see clinically, but most importantly, really go into detail how to exercise effectively around these symptoms. And to find exercise as medicine, so the most effective forms of exercising. So we know that AIMS is very common. AIMS is aromatase inhibitor associated musculoskeletal syndrome. Big mouthful. So we just call it AIMS. This is just basically the joint pain that a lot of patients tend to get when they are taking hormone therapy. This tends to come on quite quickly and within the first 3 months in particular of taking hormone therapy. It's often in the hands, the knees, the neck, the hips. If you've been sitting for a while, you feel really crickety and stiff getting up. So this is the most common symptom that I definitely hear about, and that can be very challenging. Another common symptom is fatigue, as well as bone mineral density loss. So those are the main side effects we're going to talk about before we talk about how to exercise safely and effectively. The first part of this blog just kind of links other previous blogs in more detail if you wanted to know a little bit more about breast cancer-related conditions that I treat, managing cancer-related fatigue in a bit more detail and a bit more comprehensively, and then elements of kind of returning to work or disability funding. I have lots of resources on that, so those are all hyperlinked at the start of this blog. But data does support that more than 50% of women who take hormone therapy for hormone-sensitive breast cancers have side effects, and primarily AIMS, joint pain, fatigue, and at times bone density loss. So exercise as medicine is super important, but we want to make sure it's done effectively and safe. And when it is done effectively and safe, it helps with all the right things, reducing them, fatigue and pain, and it helps with all the good things, mental well-being and bone health, and helps improve it. But before we kind of go into exercise medicine, let's just cover once again the basics. It's really important to consider, like, why is hormone therapy important? Well, up to 50% of the cases, the survivorship rate, 50% of the survivorship rate can be increased at times up to 50%. So we see that this one intervention can be very impactful, sometimes one of the most impactful amongst all three: radiation, chemo, and hormone therapy. So it really can have impact on reduction rate and risk rate. But it's still very important to know the statistics. So I always encourage patients to have a conversation with your medical oncologist and see if there's any data that is specific to your breast cancer diagnosis, stage, grade, and type, and if there's any data around that and the hormone therapy efficacy. So what kind of reduction rate or survivorship rate is specific to your case. And at times there is data specific to that. This is really important because this helps you to make an informed decision, and informed decisions can help patients make better risk assessment. So that's just something that, if you're able to obtain that information, can be very useful. There are lots of types of hormone therapy. This accordion here on the website, as you kind of click, elaborates on all of them. Aromatase inhibitors are the most kind of common ones prescribed in the older population or post-perimenopausal: anastrozole, letrozole, aromatase. But we also do see SERM category of tamoxifen that can be prescribed often as well, especially if you are not going through menopause and you are younger. There's other criteria as well. Your medical oncologist will speak to that. But now let's go into the more difficult part of this blog, which is the side effects of hormone therapy. And like we first spoke to, cancer-related fatigue is a really big one. This can even exist before we throw hormone therapy into the mix. So I have a link here just kind of elaborating a little bit more on managing general cancer-related fatigue. There's a lot of mental models and tools to do that. Lots of resources available on my website. Pain is obviously another big one that can exist too, even before hormone therapy is thrown into the mix. So I have some general tools on managing cancer-related pain. But once again, then when you throw hormone therapy into the mix, this is how all these things can get exacerbated, and it's kind of the icing on the cake. So it can be really challenging for women to undergo this final step of hormone therapy. Women are already prone to loss of bone mineral density due to loss of estrogen. So menopause already puts women at risk, while hormone therapy accelerates that bone mineral density loss even more. So this is a really big side effect of hormone therapy that we need to focus on, and we're not doing great at it. But exercise has incredible possibility here, and we will talk about that more in this blog, specifically what that looks like. So once again, what's the mechanism of hormone therapy? Well, it shunts estrogen. With aromasin and aromatase inhibitors, when you take that pill within the first 24 hours, up to 70% of your estrogen can be halted. So that's how quickly that AI kind of class can work. Tamoxifen works in a slightly different mechanism, but you just see that generally these hormone therapies are suppressing estrogen. Well, why is estrogen so powerful? It is an incredible hormone that does a lot of things. We know that it plays a very important role in promoting glucose as fuel for muscles. So literally estrogen is like the fuel for your muscles. And so its availability will really impact your exercise tolerance. That's why if estrogen is kind of halted, you might just all of a sudden feel like you just can't access that fuel and energy in your muscles. And women have probably been experiencing this throughout most of their lifetime after they have started menstruating, because times in the month exercise must just feel and does feel tremendously more difficult. And now we are really starting to talk about that more and more in women's health, which is so exciting, and just talking about how women are different. We are not small men, and exercise, nutrition, sleep needs all vary depending on the stage of our cycle. So all that science has become more mainstream, which is just super exciting. And unfortunately, hormone therapy just kind of adds another layer, because we're accelerating that menopausal process and kind of almost, crashing women into it. So we really do need to talk about this and make sure that women have the tools. So one of the first side effects, as you know, fatigue. This can be cancer-related fatigue even before the hormone therapy, or it can be related to the hormone therapy. And so this is where we do need to consider some tools. And once again, I speak a bit more to that in my blog. We really want to avoid push crash. That is the biggest thing we want to take from this. That push crash is very expensive. So when we're dealing with fatigue, we want to work with various tools and mental models to try to work within our energy envelope and conserve energy, going low and slow and increasing over time. Once again, just kind of going back to why fatigue can occur with hormone therapy. Well, estrogen is anti-inflammatory, metabolically boosting, and it's also bone building, as we know. So that metabolically boosting kind of capacity can be part of why all of a sudden there's just a different kind of basal metabolic rate to some degree, and women just tend to feel tired. They also can feel tired because they have less anti-inflammatory estrogen circling around, creating more pain, which then can kind of create a little bit of a vicious cycle. The first 3 months of hormone therapy are always the most challenging. A lot of the data shows this, just because the estrogen drop is quite acute. But after 3 months, we can actually see some really significant change and some really promising upsweep, or movement of things into a positive direction. So I always encourage patients to know this timeline, because sometimes it's really challenging in the first 3 months. They're not sure if they can do it, and then things do really change. One of the theories, maybe also as to why things change after 3 months, is that the hormones released from like exercise and some other areas of the body, such as catecholamines and norepinephrine, these can help reduce fatigue and pain and inflammation. So it's like some of these other hormones kind of start coming to the game and picking up slack, and that can help for the lack of estrogen. Another common side effect, hot flashes. Anyone who's had this will tell you it's a lot more than just feeling hot. It's a sudden profuse onset of a rapid heart rate, spreading, kind of increase in body temperature, just a feeling of overwhelm. I really elaborate more on managing hot flashes in my Managing Hormone Therapy blog. That's just a general elaborate blog on managing the side effects of hormone therapy. What I speak to with hot flashes is the concept of cooling down your body, specifically your glabrous tissue. That's through the forehead, the palms, and the feet. So you can click on this link to learn a little bit more in detail about how to manage hot flashes. The third but most important side effect of hormone therapy is that we see AIMS. We see this joint pain and stiffness. And once again, compounded from the decrease of estrogen, we see decreased levels of kind of generally dopamine as well. And all of this is just associated with more pain in the joints. And so this has been classified as AIMS in the medical literature. So it is a condition. It is important to know it's not just I'm feeling stiff or I have some pain. You can understand that a lot of women definitely have this condition. There's a big thing of what I focus on and treat. Estrogen, we know, also creates kind of tensile strength in all of the tendons. And so tensile strength is this beautiful combination of like flexibility and strength, elasticity, but durability. And all of a sudden we just don't have that extensibility. It's like they don't release energy as well. And so they're stiffer because of the loss of elastin and collagen. And so that can just lead, once again, to a lot more pain all throughout the body and make exercise harder. Once again, the good news is that your body has the ability to produce endogenous, which means within your body's own opioids, catecholamines, norepinephrine, Mother Nature's Advil. These can reduce pain and inflammation. So we can talk a lot about how exercise can help. Once again, I just think it's important to quickly touch on pain. We just want to dabble into pain science here, although I have a lot more blogs on how to manage cancer-related pain and a little bit more detail on pain science principles. We just want to remember that pain is protection. Pain is not detection. So when you are experiencing discomfort in some areas of your body, it's not that the tendons are ripping or the joints are grinding or you're doing harm. Not necessarily. We always want to kind of in the back of our mind remember that pain is protection. PP. Pain is like an alarm system and it's going to go off to protect you. What's difficult in a cancer diagnosis is that a lot of the treatments you undergo, chemotherapy, radiation, and so on, hormone therapy, can make that alarm system more sensitive. So if we have a very sensitive alarm system and we hide in a corner, it's probably not going to help because the alarm system is just going to keep going off. So what we have to do is we have to recalibrate. We have to retrain that alarm system. What is safe? What is threatening? And exercise is a huge tool for this. So really important pain management is working with your body's own ability to retrain its cues. So we talk a lot about that in our exercise prescription here at the Cancer Physio. So the last symptom, once again, women are already prone to this. Hormone therapy is going to accelerate it, is loss of bone mineral density. So, standard care here, I would say, is it's very important to have baseline and periodic measurements. If you're not getting referred for regular bone scans, you might consider a DEXA scan, consider supplementation like calcium and vitamin D, and bone building exercises. So we'll talk about what bone building exercises are in this blog here. And they do need to be personalized to you. I do have patients who have bone metastases, and in that population, when they come and see me and they want to build better bone health, sometimes they're doing some things that are not quite safe. So it does need to be personalized to your diagnosis and stage, but bone building exercise would be your biggest point of power, your biggest way to have impact to stop the risk of osteopenia or osteoporosis. So we really emphasize that bone building exercises and bone building programs are how patients can really control the symptom of side effect of hormone therapy of loss of bone mineral density. So, and there's lots of neat studies out there. The Lift More trial is an example that worked within the osteoporosis population. So, in addition, some patients also will receive anti-resorptive therapies such as biophosphonates and other injections that actually will help to rebuild bone density um, uh, as they are at such a high risk with their hormone therapy. So, this is something your medical oncologist might speak to more with you. So once again, those are kind of the side effects. So now let's dive into the good stuff, which is the tools. So let's talk now about how to manage some of these side effects. So once again, the cooling of your glabrous tissue is a really effective way to manage hot flashes, not fanning your face or kind of dabbing in cold onto your face. We have specific areas of skin that are like portals into your core temperature. Can't emphasize that enough. So, like this photo awkwardly shows of my calloused feet and big hands, these are in areas that we can quickly change our core temperature. So, you can click on these links here to learn a little bit more about how to do that effectively. I've spoken a lot too about cold plunging, cold exposure. I've spoken about this in terms of dopamine release and mental well being, fatigue management, lots of other cancer related conditions. And in this case, too, when we're dealing with fatigue and we're dealing with loss of estrogen, loss of dopamine, cold plunging can be a pretty exciting tool to cause a surge of dopamine, which can just help with motivation and well being. With that, we also see a decrease in some of the interleukin related kind of inflammatory cytokines. And so, once again, you will just over time have the possibility of experiencing less inflammation in your body through consistent cold exposure. So, once again, this is a phenomenal tool. I used to do this a lot when I lived right by the ocean. I was consistent with it for years, and I did it all throughout fertility treatments when I was nauseous and tired, and it helped a lot. And so, more details on our cold plunging protocol and how to do this safely when undergoing cancer treatment can all be found throughout these links here on the blog. So, kind of cold plunging video will go over the blog like this, and then we have further links down there to the full blog. Access. One of the really interesting data points that I heard recently that I just loved was that cold plunging actually has an effect on heart rate variability. This was my last post. Heart rate variability is this really cool data point that we can use to assure that we're not working into the push crash as cancer patients tend to do. It's a really neat tool that can assure that the amount of stress is optimal, the amount of exercise is optimal, recovery is happening, and we get this really good recovery throughout a cancer diagnosis and effective exercise that is the right dose and type. So heart rate variability is something I've been really diving into and working a bit with my patients and seeing really cool results. But once again, the cold plunging links are all here, and you can access more information about the specific protocol and so on and how to do it safely. So the most important tool after all this blabbing is exercise as medicine. And how can we use this to achieve specific goals? Well, firstly, we don't want to worsen fatigue, right? So this is where we want to try to achieve the right dose, that we're not making push crash happen. My heart rate variability blog speaks a lot to how we can use this metric to track exercise intensity. When we're talking about specific to hormone therapy, we really want it to be gradual, consistent, guided by how you feel. Even if the data, your heart rate, and so on say other things, you and how you feel is more important than any data point. Very important to know that. All these things we use to monitor our biometrics, watches, phones, and so on, they have limitations. Most accurate is how you feel. We will then also talk a little bit about how strength training, aerobic exercise pair together well for a comprehensive program for battling the side effects of hormone therapy. It is very important to consider clinical considerations. I mentioned this a little bit briefly earlier, that some patients do have bone mets. In that case, and if you are high fracture risk, you need a personalized exercise program, or consider my resources here where I talk about how to exercise safely with bone mets. We also really want to consider avoiding repeated spinal flexion and twisting with load. So like Russian twists, where we grab a ball and we're twisting, probably not the best idea in terms of the risk to the spine. We also want to consider the safe cancer and exercise guidelines. So there are some scenarios where certain levels of white blood cell, red blood cell, and so on can mean that exercise stress is not optimal at that time. So these are important clinical considerations before you get started with any exercise program. So once again, what does strength principles look like to manage hormone therapy? We talked about how hormone therapy can cause fatigue. And so with that, we know that's because it can impact the metabolism. Estrogen is very metabolically boosting, and now we've pulled that back. So we can boost our metabolism with one of the most important tools, which is muscle tissue. It is the most metabolically demanding thing. It just consumes energy and requires a lot of energy. So it's great for giving us energy, and for weight maintenance. So strength would be a really big goal for women who are on hormone therapy and struggling with fatigue and with pain. And so, what does that look like? Well, the most important principle with a strength program is this principle called progressive overload. Probably hearing this a lot lately in the literature. It is just the term in science that you are increasing the load over time such that you are feeling distress. So muscles must be challenged beyond their current capacity. This means that the amount of repetitions that you're doing the exercise for should be a certain number. And by the end of those few repetitions, it should feel hard. Hard can mean shaky, hard can mean fatigue, hard can mean you can't do the full range. Hard can also mean an acidic kind of feel because lactic acid is burning and building up. So we really want to achieve progressive overload with strength training. If you haven't done a lot of strength training before, this might be a feeling you're not used to or that you don't like. Take some getting used to. Very different than walking or hiking or the cardio world that a lot of women love. But this is a very important principle of how we get effective strength training. The other principle of strength training is specificity. So what you're training and the muscles that are doing the work, those are the muscles that you're training that are doing the work. So if you want to get multiple muscles going, it's good to do multi-joint movements. The world of bodybuilding is kind of trendy, but it's really not that functional and it's not that impactful for kind of what we want to achieve for hormone therapy management. So we're doing kind of what we call compound moves like squats and lunges and kind of more full body movements, not bicep curls. And we are trying to get multiple muscles working. Frequency is very important for strength training. If you go to the gym and work so hard for 90 minutes, but you can't make it again for a week, it's not productive. So consistency is the most important name of the game. So we want at least 2 to 3 sessions per week. Hopefully the soreness can be limited because we do this nice and slow and gradual so that you can safely and effectively exercise 3 times per week. If you're getting so sore that this isn't possible, let's talk about it because there's lots of tools that we can talk about to promote better recovery. Intensity is also very important for exercise when it comes to strength principles. We do want kind of that higher load. That's the goal so that we can get that rep of 8 to 12. If you were doing 20 repetitions of something or 30 repetitions of something, you are not promoting strength. This is a different category of exercise. It's very important to know that is more strength endurance or even stabilization posture. So this is where it is important to understand that if the goal is really to gain strength, to boost your metabolism, to help with fatigue, and to provide some stimulus to the bones, this is the principle. These are the principles that you want to abide by. So once again, volume, we're doing 2 to 4 kind of sets, and repetitions is anywhere from 8 to 12. We really want to bear in mind for beginners, once again, you're not starting with that 60 to 85% of your 1 rep max. You are starting lighter. And once again, it's very important with a strength program to go low and slow because we can have soreness, we can have injury, and so on. So it does take some personalized guidance. The second principle we want to talk about with exercise as medicine is now bone building. So the other side effect we talked about was loss of bone mineral density. So we've talked about strength, how to boost your metabolism, how to help with fatigue, how to help with pain. But what about bone stimulus? It actually looks a little bit different, believe it or not, than a strength program. So the interesting thing about bones is that they become desensitized very quickly to repetitive loading. So bones like change and they actually like novelty and they need impact. So this is where your bone health actually has to be good in order for us to stimulate it. If you have bone metastases, we're not going to be able to adequately stimulate that bone such that we're going to be able to promote a lot of bone mineral density change. That's just the reality. If you want to stimulate bone mineral density change, it's because your bone is healthy and is not metastatic. So what does a bone building program look like? Well, intensity, first and foremost, is very high. So we have a higher stimulus, we have a higher load, we're doing a heavier weight. Types of exercise, once again, multi-joint. You're going to get stimulus to multiple joints. Bicep curls, not going to do a lot, just your elbow. But if I do like a curl to a press, then I'm going to be getting my elbow, maybe my wrist and my shoulder, maybe a bit of my spine and hip as well. So we like multi-joint exercises. Once again, speed is a really powerful variable in bone building. We want to make sure that you're there and safe at a point where you can add speed, because speed is the biggest variable that correlates with injury. So when people start moving faster, they tend to get more injured. So we want to make sure that you're healthy enough and things are safe enough before you do this. But speed is a really great variable for building better bone stimulus. Once again, frequency, actually with bone building, you could be a bit more frequent, 3 to 5 days per week. It's not like strength, because you don't necessarily have the soreness limiting you and you're not getting the same kind of muscle strain. So you can be more frequent with your bone building program. And once again, novelty and change, very important. So what are the key takeaways? Strength is more repetitive, okay? We are doing kind of specific repetitions of a specific movement, and we're doing, 3 to 4 rounds of that. We are progressively overloading, so we are trying to pick a weight that's challenging, that feels harder over time. And with strength, we need recovery, because we're actually doing tissue damage, and that's why that rebuilding of that tissue is what boosts your metabolism so much and consumes so much energy. With bone, we're doing heavy load, and maybe it's fast, maybe there's some impact, and there's variation to that over time. So it's a little bit different than strength. Both require consistency, and both are very important for managing the side effects of hormone therapy. So a good exercises medicine program would be tailored towards strength and bone building for women. So here's a sample strength and bone building program you can access. Very minimal, very simple, but once again, not personalized to you. So I can't guarantee that this is adequate for everyone, but it's a nice little overview. Once again, the last principle is aerobic training, and I'm covering this because this can be very powerful for pain. So once again, we talked about if estrogen goes down and it's a anti-inflammatory, we need something else to make up for that. Adrenaline, catecholamines, all these beautiful, amazing hormones we get when we get our heart rate up for a longer period of time. This is how runners can run sometimes for 3 hours and pains kind of come and go, or they don't feel the injury. And only after, when the hormones have kind of come down, some soreness starts to kind of creep up. But it's a really powerful thing to tap into your body's own pain killing mechanisms, and aerobic exercise can do that. So this is particularly important for AIMS and pain management. So once again, with aerobic training, we need to start low and slow. Our tissues, our joints and tendons aren't used to this kind of volume of going for 45 minutes or 2 hours. So we need to ease into it over time. Usually we don't increase more than 10% per week. And here is an effort scale of kind of how to gauge how hard you're working. It's very important to start with light to moderate stress to avoid that push crash. So here's a few more principles to abide by. And all the time we work with patients who want to kind of get back into running or train for a cycling event, and do that slow and safely through and after a cancer diagnosis. So once again, with aerobic training, key takeaways: go low, go slow. We increase duration before intensity. We aim for consistency. Once again, 3 sessions to 5 sessions per week. We start maybe with 15 minutes. We stay below the symptom flare. So if you're having a threshold, and I work all the time with patients where if we go above 45 minutes, the back constantly hurts and the spine aches, well then let's go just below that and let's train below that threshold, so that maybe eventually that really sensitive threshold, that alarm system says, I'm safe, and the threshold increases, and then we can train a little bit harder, a little bit longer. So that's how kind of desensitization works. So once again, consistency matters more than anything, as we know, for long-term pain reduction. But that is just an overview of the main side effects of hormone therapy, and then the main kind of exercise principles that we can use to target those side effects. So we talked about side effects of pain, fatigue, loss of bone mineral density, maybe concerns about metabolism as well, and weight gain. Touched on that very lightly though. And so how can we use exercise? We can use exercise to build strength. We can use exercise to build bone stimulus, which can help with bone mineral density, and strength can help with metabolism and fatigue. And then we talked about aerobic training as a means to combat pain. So exercise is medicine when done safely and effectively, and at times with a personalized approach, can be a very effective way to manage the side effects of hormone therapy. Thank you so much for listening today. And as always, thank you for your interest in science and rehab.